This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health, you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning. Welcome into the program. Dave Wilson along with Sarah Giosi. Good morning, Sarah.
Good morning, Dave.
And our guest in studio today is Emily Hare, nurse practitioner with the Mon Health Heart and Vascular Center. Good morning, Emily.
Good morning. How are you guys?
We're doing great. I still have turkey hangover, though.
Yeah.
Well, pumpkin pie hangover. Pecan pie hangover. You still eating leftovers?
No, not really.
You wouldn't eat leftovers anyway.
I'm still eating.
All right.
Are you
Emily
good?
and I.
Good.
What about the other Emily? Emily's still eating leftovers over there, too. Well, around your clan, though, you may not have any leftovers anyway, with as many people running around the Giosi Rowan clan.
Yes, there's. Even then, we have so much food, but no, everybody eats it all.
All right, we'll discuss your Thanksgiving later.
Yeah, we'll do that later.
As I mentioned, Emily joining us in studio, nurse practitioner at Mon Health Heart and Vascular Center. So guess what we're going to talk about today?
Hearts.
Hearts, yeah.
Huh.
We'll get to that in a moment.
Who knew?
But first, as we always do, we like to get to know our guests a little bit. Emily, talk about yourself. Where are you from? How did you end up at Mon Health?
So I am a West Virginia girl at heart, born and raised in Parkersburg, West Virginia. And then I moved to Morgantown after graduating high school to go to WVU. WVU is where I earned my bachelor's degree in nursing and also my master's degree in nursing. And then I decided to stay here to work. I just love the Morgantown area. There's a lot of opportunity for healthcare providers, so I was really interested in staying here to kind of advance my career.
Why cardiology?
I've always been very interested in cardiology. So when I first started as a registered nurse, my experience was at the bedside in the cardiac intensive care unit at Ruby Memorial here in Morgantown. I worked there for about 2.5 years, and then I transitioned into the role of a circulating nurse in the cardiac cath lab at Mon Health. So I've always kind of worked with cardiac patients. That's always really been my biggest interest. And I loved working at Mon. I loved the working environment and the feel of a small community hospital. So I was very interested in staying there as a nurse practitioner, and I was super excited to stay on with cardiology.
What do you do in your role as a nurse practitioner?
So as a nurse practitioner, my training is I am a board-certified family nurse practitioner. So my training is I am able to take care of patients throughout the lifespan of any age. So I have a lot of opportunity to work with a lot of different ages and a lot of different roles. My current role is I am the provider over the cardiac stress lab at Mon Health. So it's an inpatient stress lab where people, inpatient and outpatient, come in to get their stress tests done.
So when you have to get on that treadmill, and we'll go over more what the stress test is, but that's the one where you got to get on the treadmill, you got to breathe into that weird tube, and you plug your nose, right?
So there's multiple different stress tests, like you said. The most common one that people know of is the treadmill stress test, and it's not something that most people look forward to. But we do try to make it, I guess, as least painful as possible for people.
You ever done one of those, Sarah?
I have not.
I've actually done a medical procedure.
Yeah.
You've not?
Yeah, I've not done
That's
that.
never happened in this show, Emily.
Well, you
That's
can
never.
come. Feel free. We'll get you on that treadmill.
All right. Hey, all right.
It's
I'm
not
ready.
fun. You would pass with flying colors, though.
Maybe. Who knows?
We are talking to Emily Hare, nurse practitioner at Mon Health Heart and Vascular Center. We are going to get into stress tests. I didn't know there were different kinds. You just kind of threw that in. So we'll talk about that coming up as well. Who might need them, when you might need them. We'll get into all of that, of course, over the course of the next 20 minutes or so. Right now, let's squeeze in a break. You're listening to Mon Health Talk on WAJR. Talking to nurse practitioner Emily Hare at the Mon Health Heart and Vascular Center. All right, I kind of jokingly said everybody, I think, is familiar with the treadmill and the breathe into the tube and plug your nose stress test. They're awful. They're awful. But what other kinds? What kinds of stress tests do you put people through? And then we'll get into a little bit more about who needs them. But what kind of tests are there?
So there's a variety of different stress tests, and we usually make the decision based on what each patient gets, based on what we're looking for and what's best for them. There's two main types that I would say most people are aware of and the most popular. So the first type is what you already said, the treadmill stress test, where we have a patient get up on the treadmill. We want them to reach a certain heart rate based on their age. And we pretty much let them go on the treadmill until they say they can't go any longer, which sometimes they really don't like us for that, but that's the best way to do it. And then there's a second type of stress test called a chemical stress test, where this would be for people that can't safely get on the treadmill for certain reasons, because that does happen, or they have certain heart rhythms where chemical is really the best option. And we will give them a medication in their IV that pretty much stimulates stress on the heart. So these patients will get pretty significantly short of breath very quickly, so it makes them feel like they're on the treadmill.
So to clarify, Sarah, the reason that I've had a stress test is I was working at a particular gym at the time, and it was a benchmark.
Mm-hmm.
You know, this is how fit you are, and then I think it was a year later, maybe 6 months later, something. You did it again, and it was a measurable there.
Yep.
And you could see, and you could tell the difference when you got up there that, okay, the second time you did it, you didn't feel like you were going to have a stroke. The third time you did it, you didn't feel like you were going to die again. So why would you give somebody a stress test?
So there's a lot of reasons why people get stress tests. I see a lot of different age ranges. I think the youngest patient I've had was about 18. And I think she was having it because she had been feeling palpitations, feeling like her heart was fluttering and kind of skipping beats frequently. But then we also have patients, 80-year-old patients that get up on that treadmill. But most of the time when people come to the stress lab, they're there for a reason. So they've been to see their primary care doctor, they've been seen through the emergency room, and they're not feeling well. They're complaining of chest discomfort or increased shortness of breath when they're doing their normal activities. Now, like you said, you had a stress test to kind of test your endurance. We also see that sometimes. We also see people for stress tests prior to surgical procedures, just to make sure that they're safe to undergo that surgical procedure. And then also for occupational clearance. A lot of the time we see patients men and women who drive truck for the Department of Transportation, that need a stress test to clear them to make sure that they're safe to drive.
When doing a stress test, what is something that could come out of that? So if I come in and you're measuring and you're doing it maybe just to clear me, what are some of the things you could potentially find, though, through the stress test?
So normally the reason we do a stress test, the most common reason, is to help diagnose or make a prognosis of coronary artery disease. So when someone's up on the treadmill or when they've gotten the chemical stress test, we look for things like, are we able to reproduce the symptoms that they've had? So if this patient's come in with, they're complaining to their primary doctor of chest pain, are we able to give them that same type of chest pain when they're on the treadmill? They're also hooked up to an EKG the whole time, so we're able to watch and see, does their EKG change? And could that indicate some type of blockage or something of that nature?
So along those lines, if someone's listening, what should they be keeping an eye out for? What are some symptoms that they should be noting that then would maybe lead them to coming and having a visit with you?
So I think that when most people think of heart trouble, they think of the classic symptoms of a heart attack. So they think of that feeling of an elephant sitting on their chest, or that very intense burning in the middle of their chest. Which those are important things to look out for. However, I think it's also important to note that sometimes chest pain can be different for everybody. So whereas someone may experience that elephant sitting on their chest heaviness, other people may just have a dull ache. They may have a squeezing feeling. They may have something that feels like heartburn. It can be in the middle of the chest on either side, or it could even radiate to the neck, jaw, or down the arms. So I think that all of those are things to watch out for, as well as I said earlier, I think a big thing for some people that some people don't pay attention to is having difficulty doing the things you normally do. So not being able to vacuum your living room without getting short of breath, not being able to walk up the stairs without getting some chest discomfort or shortness of breath when beforehand that wasn't an issue for you. So I think that those are important things to look for as well.
Does a stress test, as you get older, different labs, different tests become part of the normal routine when you go to see the doc? the stress test, does that become part of the normal routine at some point, or is it more of a you're having some sort of discomfort, something's amiss, we're going to check this out?
So it's more of based on the individual patient themselves. It's not exactly a standard for everyone. Like when you turn 50, you get a colonoscopy. When you turn 50, you don't automatically get a stress test. It's more of based on if a patient is symptomatic or if they have risk factors for heart disease. So risk factors meaning high blood pressure, high cholesterol, diabetes. Family history is a very strong indicator. And then also if they're past or present smoker. They take all of those things into consideration, their provider, and then on top of that, are they symptomatic? Are they just more fatigued than usual? You know, do they think that a stress test would be the right thing for them?
How do you know if you pass?
Well, so usually the stress tests are a 3-part test. So a patient comes in, they get pictures taken. So they get a radionuclide tracer that kind of, we say, makes your heart glow. They sit under a camera, take pictures. That takes a picture of your heart at rest. They come into the stress lab. We stress them out. So we make them get on the treadmill and either walk or run or give them the chemical followed by another dose of that radionuclide tracer. And then they go back and sit under the camera again. And those are the pictures of their heart under stress. The cardiologists are then able to look at all the nuclear images and see, you know, what does the blood flow and the tissue of the heart look like under stress compared to at rest. But we always try to be very encouraging when people are on the treadmill, even if they're not doing well. We just try to tell them, because it is difficult. The treadmill goes steep. It has an incline. All of that, as you know.
Mm-hmm.
So it's not easy. So we just try to be really positive and tell people, you know, like, you're doing a great job. We try to make people go as long as they can.
So you're a cheerleader.
We try, yes.
Yeah.
People don't always like it,
No.
but we do try. We try hard.
It's very annoying. It's so hard to, curse the person out while you're, dying on the treadmill over there.
I feel like we
not
could
that I would
just
ever
be-
do such a thing.
Oh,
Emily.
right, no,
I mean, not that I've ever had that happen either.
No.
So.
I feel like we could be put on the stress test just doing the show,
Oh, some
especially
days.
depending on the topic.
Depending on the topic. We're talking to Emily Hare, nurse practitioner at Mon Health Heart and Vascular Center. We'll continue the conversation after this. You're listening to Mon Health Talk on WAJR. Dave and Sarah in studio, along with Emily Hare, nurse practitioner at Mon Health Heart and Vascular Center. We have been talking about stress test. I feel very stressed over here right at the moment. Can't you see it on my face, Sarah?
I feel like you're always stressed. That's why I wasn't even
I
surprised when you said
I
you
am
had a
the
stress
least
test.
stressed guy in the building right now.
I have to say, that's not saying much.
It's a very busy time of year, Sarah. Who should get a stress test, Emily?
So a lot of different people can come for stress tests for a lot of different reasons. To come see me in the stress lab, you need to be ordered to have a stress test by either a primary care physician, any kind of provider. Like I said earlier, surgeons often order them for preoperative clearance, any physician in the emergency room. So anyone that has risk factors, as I discussed earlier, or is having symptoms that could be concerning for some type of heart issue.
So I'm going to see my primary care physician first, or something bad's going to happen. I mean,
Or you're going to be seen in the emergency room
right.
with chest pain,
Then
something
I'm going
like
to
that.
come and see you.
Yes, that's
Okay.
the norm. So not only for, insurance purposes and things like that, but we want to make sure that the stress test is the absolute right test for you to have.
As we're sitting here talking about this, and heart health is so important, especially, and I shouldn't say especially, but let's be real about this, in West Virginia, because we have a major problem here
We do.
with heart health. So what do you think is the most important thing our listeners should take away from this conversation today?
So I really think that as health is very individualized, it's very personal. Everyone experiences health in a different way. I think that nobody knows you better than yourself. So I would say it's very important not to ignore things that your body's telling you. So if you feel any of these symptoms, you're getting more short of breath with your normal activities, you're getting some chest discomfort when you exert yourself, things like that. Those are not things that should be ignored. Even though it is a little bit scary, it can be nerve-wracking. The best thing to do is go see your primary care provider so that they're able to assess you and order the appropriate tests because really it's important to take care of yourself.
And again, no smoking, good nutrition, exercise.
Yes, all of things that West Virginia is not exactly known for, as you said.
Yeah.
So
What are some of the common excuses you hear from people who ignore some of the symptoms you're talking about? Oh, I thought, I'm getting older. I'm not in as good a shape as I was when I was 18. Do you hear that a lot?
I do hear that. We do hear that a lot. Also, like I said, I think people are just hesitant because they're afraid of what it could mean. But, ignoring it doesn't necessarily mean that it's going to go away. Most likely it's going to become worse. It's going to keep you from doing the things that you like to do and keep you from being with your family and those that you love.
I also think being in tune with your body, just like you said, just basic paying attention, making notes of when you used to be able to do things, but now you can't. I think we tend to, it's not even that we're purposefully ignoring, but we're just not paying attention.
Mm-hmm.
And so making it a point to pay attention.
Yes, and as you kind of said, people often say, like, I'm busy and all of that. That's true. We're all very busy. We all have a lot going on. But if you don't take care of yourself first, you're not able to take care of anybody else either.
Yeah, it's the air mask on the oxygen mask on the airplane idea. You have to put that mask on first before you can help everybody else.
That's a heck of an analogy.
Oh, that was a good analogy.
Boy, you are on point for a Monday. Yeah, of course, the Mon Health Heart and Vascular Center. Where are you guys located?
So the stress lab itself is located inside Mon Health Medical Center. So we're on the main floor, kind of behind radiology towards the cath lab. And then all of the cardiac providers can be found in the clinic at the 2000 building of Mon Health Park Drive. And you can reach the clinic at 304-599-8802. And then, of course, anyone interested in learning more, has any questions, anything like that, can find information online at monhealth.com/heart.
Look at that. And, of course,
Facebook page.
go to the Facebook page. The other Emily always gets on us because we forget the Facebook page.
She's proud of it. So.
She should be.
She
What a
should.
great
It's
page.
good.
Do you have fun at work?
I do. I work with a lot of awesome people. I really love all the cardiologists, all of the staff, the nurses, the cardiovascular techs. And in the stress lab itself, I work with a stress nurse named Carla and 2 techs, Alyssa and Lauren. And they're just a great time. It is a great place to go to work every morning. So
I love that.
Emily Hare, nurse practitioner at the Mon Health Heart and Vascular Center. Appreciate you stopping by this morning.
thank
Thanks
you
so
guys
much.
for having me.